So we are looking at hospital beds 2025, some of the best bed options in the new refurbished categories. And so there's kind of a difference between a home care bed and a hospital bed. Primary difference between a home care bed and a hospital bed is going to be home care beds usually have two rails. Hospital beds will have four. There's other differences, but I want to get in and talk about wound care because a lot of times every day we're getting calls for people that have a loved one in bed with a bed sore or risk of bed sores. And what is a bed sore? Kind of what causes it. And, some of the options that we offer, some of the suggestions, and really actually just what to look for in an air mattress because it can get very confusing. Normally speaking, you get a lot of stuff thrown at you in a very small period of time. So I want to just break this down, give you some options that we offer. And then, you can go out and start looking, but you'll have a much better understanding of kind of what you're looking for and how to evaluate it. Now, with an air mattress, this is a Hillrom Progressa bed. So air mattresses are really here for people that spend the majority of time either in bed or sitting down. So if somebody says, hey, they're only in bed 18 hours a day, but the other 6 hours they're sitting down, the only difference is that they're sitting in a chair and not sitting in the bed, but they're constantly putting pressure on the tailbone. So unless they're physically up moving around, they're always going to be in a position where they're putting pressure on their tailbone and the bottom of their heels. And those are the two areas that are the most primary places to get bed sores. Sometimes the elbow, bottom of the elbow, but usually it's the tailbone and in that area there, and then also the heels. So the number one feature, the first feature you're going to see with an air mattress is something called low air loss. Now, these beds have air bladders that go across the length of the bed. And on the far left and on the far right, there's going to be little tiny holes that release air. So the holes are there intentionally. They release air. That air circulates over the surface of the mattress. And what it does is it whisks away moisture from the skin, right? So bed sores are primarily caused a lot of things, but primarily it's friction, pressure, and moisture, right? So the first thing that the air mattress system is going to do is it's going to run air over the surface of the mattress. That's going to whisk away moisture. And when that moisture gets whisked away, it keeps the skin dry. Now, if it's a situation where they already have a bed sore, that's going to help dry up the skin. Now, if, sometimes there's a pad with maybe some incontinence issues, or maybe there's already a wound there and there's going to be bandaging, that's okay. We still want to dry everything up around it. Now, the important thing about low air loss is that it is only as good as the size of the compressor and the size of the holes that are pushing air out, right? So there's a big difference between a home care bed and there's a big difference between a hospital grade air system. And so home care air system, you'd say, well, it's got low air loss. Yeah, it does. And basically, but the holes are so small and the pump on that bed is so small that the amount of air circulating over the mattress is really not going to be, it's not going to be preventative enough for somebody that's full-time in bed. If you're full-time in bed, even though you're at home, you still need really what I would call hospital grade care. And so this bed's a little different right here because this is a bed where the pump is built into the bed frame, so you can't actually see it. But being that this is a pulmonary bed, this is the Hillrom Progressa, which is the best bed really you can buy on the planet right now. But you don't always need this, but I'm just using this as a demonstration for giving you an idea what these mattresses do and how they work. Now, the pump hangs off the foot of the bed. It runs a lot of air. And in a really good air system, they're going to have two holes in these areas. So this area where it's most likely to get bed sores is going to run even more air. And you're going to determine, like we sell a couple different brands of mattresses that can go on the bottom. Like over here, what we could do is say, you don't need all this. This is a little bit on the high end. Then what you do is you take a regular hospital bed and hang the pump off a hook like this. You still have control and access to all the features of the bed if you need a scale, whatever you need. But rather than that, then you hang the pump off here, and then the mattress will zip tie into these sections in the frame to keep it connected so it conforms with the shape of the bed. So when you're looking at low air loss, which is going to be the primary feature, the first thing you have to look at is, like I said, the size of the pump, the amount of air that's being circulated over the mattress. Now, once you're done looking at that feature, that's an important feature. That's really the most important feature for drying up bed sores. So if we're talking bed sores, wound care, how to heal bed sores, that's what you're getting in a hospital. And since we deal a lot with hospitals, and since I've been doing this a long time, there's a real clear standard between a hospital grade air system and a home care. Although we do sell home care equipment, because sometimes from a budgetary concern, it's like, this stuff can get expensive fast. So we want to have options and layers of options. And then, if you can't get into the progressive bed, which is not always going to be the best choice anyway, because, sometimes the person in bed, if they're paraplegic, as an example, putting them into a chair might not really even be possible, right? You might just be picking them up in and out of the bed with a Hoyer, and therefore, some of the features this bed has wouldn't even be used. But this is going to be a hospital-grade air system, and this is top of the line. So it's just good for the sake of the video to have it here. But then we could say, okay, well, let's do this. Let's take this bed frame, and then we'll offer a couple different mattress options that we can put on this bed frame. And this thing is super reliable, never breaks down. It's one of the best beds really made as what we would call it's called a med-surg bed in a hospital. This is ICU, this is med-surg. The ICU technically means a hospital bed with an air mattress and a scale. Med-surg is normally a foam mattress, but what happens in a hospital, they might run low on ICU beds and say, right, pull the foam mattress off, get an air mattress on there. They convert it into an air mattress, and then technically it does become an ICU bed because it has the scale and bed exit and some of the things you would need to still make that requirement. But when we are giving you out options, which would be two different companies, maybe three sometimes, that we work with, we're going to make sure that you've got the really good low air loss systems, and also alternating pressure where every other air bladder can inflate and deflate. Sometimes they use it, sometimes they don't. But the other feature that's also come into play sometimes is going to be the lateral rotation. That's the technical term. The common sense term would be patient turning. So the mattress, and this bed does it actually, I can kind of show you here. This bed does the patient turning. So what we can do here is just go in, and it's called lateral rotation, but basically the mattress will inflate and deflate, and it'll help turn the person left to right. So, technically the turning feature is really good for bed sore prevention. It's good for treating bed sores because it moves them off their tailbone and onto the side of their hips. And a lot of times, if it's a home care situation, family members are getting up all night trying to do that. Or if it's in a long-term care place, that staff have to make sure they keep up on it. And it puts a lot of pressure on a lot of people. So if you can just come in and say, you know what, here's what we're going to do. We're just going to start, and this thing is going to start turning for us all night long. And you can choose the parameters of how often the turning's being done. You'll already see here that this side of the mattress is inflating and this one's deflating. So it's getting ready to turn them to the patient's left-hand side. But that helps keep them off the tailbone. A lot of these mattress systems are going to have a softer foot section so that the foot sinks deeper into the mattress. It's not just the surface of the heel, but the whole heel will come into it. And so that is also going to help protect the heels. And then, as the person's being turned and you keep moving the bed side to side, then that's also going to be very helpful for keeping them moving and not having them staying in one position. So we sell all these different beds by Hillrom, Stryker. This is the Secure 3, the Secure 2. This is actually a birthing bed, not relevant here. The Centrella bed. We've got VersaCare beds, Arjo Huntley beds, and we have all these, and we have technicians, and we do, so we sell some stuff brand new. We sell some stuff refurbished. It just depends on what's the best fit for you. Generally speaking, you know, with some of these beds, like even the Secure 3, you can get this bed right here at the same price as buying a new home care bed. So in some cases, this might even actually be a really good option, and then equip this either with foam or air. Start with foam. If you get to a point where you need air, you can do that. But you can see here now how the mattress is turning this person to this side. So if you're a person that's looking for a hospital bed, if you're dealing with bed sores, wound care, that type of situation, give us a call. We know this stuff very well. If you probably realize, if you start poking around, I've probably got 150, 200 videos on this. I've been doing this 15 years. We sell beds by the thousands. And so we know this very well. And we've got locations in California and Virginia, and we ship beds all over the country, all over the world, actually. So you can get in touch with us at Virginia here is 540-327-7278. You can reach us in San Diego, California, North County, San Diego, at 858-263-4894. And this is another video now on various different hospital beds, but talking more about wound care, what is low air loss, how it works. Like I said, little tiny holes on the left and the right-hand side, pushing air over the surface. That air is taking away moisture from the skin. And low air loss is only as good as the size of the pump and the amount of air coming in. So you can see a mattress for very little money, less than $1,000, $500, $600. It has low air loss. Yes, it does. But is it enough air to help somebody that's going to be in bed full time? Probably not. Probably not. And so when you're paying more money for this equipment, what are you actually paying for? You're paying for a bigger pump. You're paying for larger holes. Like I said, hospital grade mattresses are going to have 2 holes down here. They're going to run a lot of air. A high-end home care mattress will do the same, but it'll run 15 minutes and then shut off the low air loss for 15 minutes so it can re-inflate the air system. Because as you can imagine, if you're pumping air to a mattress and it's letting air escape, that's kind of just that whole concept is kind of interesting. But you have to push a lot of air into the mattress, obviously, if you're letting air escape. But it's that air that's moving over that helps dry up bed sores. So we have websites, the #1 Hospital Beds, Hospital Bed Shop. But a lot of times call us. We can help you find the best configuration for the best bed, the best mattress system that's good for you, and help you with your family members, your hospital, whatever it is that you need. USA MedBed, Hospital Direct Medical, give us a call and we'll be happy to help you out with a situation that fits your needs. Thank you for watching our video. Subscribe and share, and stay tuned for the next one.